First of all, I just want to tell you I drive for Creek Carrier Corporation, and Tuffy came to live with me on October 1st of 1997 when he was just a 9-week-old kitten. And 5 days later, he was on his first trip on the truck. We've had great times together. He's seen all 48 lower states. He's also been up to Ontario, Canada. And we've shared a lot of good times and adventures together. Yeah, I took him into his normal vet for a routine examination, teeth cleaning, and when they did that, they discovered that his right tonsil was 4 times normal size.
Preventative care is absolutely critical in diagnosing tumors in the mouth, whether we're talking about a dog or a cat. And in Tuffy's case, that is absolutely exemplified. Tuffy went in for routine oral exams on a regular basis at least twice a year, and it was during one of these routine dental cleanings that the family veterinarian found the cancer very far back in his mouth, affecting the tonsil.
And when I learned of the diagnosis, I was devastated, because he means a lot to me. He's family to me, and I was afraid I was going to lose him.
Squamous cell carcinoma is the single most common cancer that cats will develop in their mouth. It generally develops in cats over 10 years of age, and most often it's not diagnosed until it's very advanced. That means that the cat's not eating, the cat's drooling, is losing weight, quality of life is very poor.
And I called the VCS up to tell them about Tuffy's problem. That's when they told me about Dr. Elmson. I brought him in for his initial examination, and she examined him and told me what they could do. They recommended removing the cancerous tonsil.
When we first evaluated Tuffy in April of '09, the tumor was 1 centimeter in diameter, affecting the tonsil. That was still small enough that we were able to treat the tumor with 3 high doses of radiation to try to consolidate the tumor, shrink it down, and then go into surgery to surgically remove the tumor and surrounding tissue. And Tuffy did very, very well with that treatment, was eating and drinking very well after surgery, again because the tumor wasn't that large when it was diagnosed.
He tolerated very, very well. Unfortunately, I had to leave him at home for that month. He was undergoing treatments, but some friends of mine brought him in there, and they kept an eye on him and said he did very well. Throughout the whole time, his appetite was good. He did not lose any weight.
Since surgery, Tuffy has been on low-dose chemotherapy to prevent progression of the cancer to the lungs and the lymph node. He tolerates the chemotherapy very well, and Tuffy and his owner continue to travel the country.
I tell you, Dr. Elmsey and our staff have been terrific. They've been very kind to Tuffy, and they've been very helpful to me. And also, too, I want to say, too, I think prayer had a lot to do with his healing, too. I'm very pleased to say this, that right now he is cancer-free, and he has been so for over a year.